place order is now on about day 10. And we'll be considering next week. It ends next Tuesday, April 14th. We're currently gathering data to find out whether or not we can end it at that time or whether we need to extend it. And some of the data that we're looking at is what's our hospital capacity, and how do we think we're trending on hospital capacity? What's our testing capacity, and how are we trending on the number of tests that we've done, as well as the number of tests that we're capable of doing? How are we trending on our cases, our positive results on those tests? Are we trending up? Are we seeing a reduction in cases? Are we seeing a sustained reduction in cases? So those are some of the criteria that we're looking at, and we'll be gathering that data over the next 4 or 5 days until we hit Tuesday. This item will be on the City Council's business meeting agenda on Tuesday, and it will be decided by the City Council as to whether or not we extend the shelter-in-place order for the next, I would anticipate taking it in 2-week segments. We've said all along that we wanted to have a measured, common sense response to the actual data coming out of our community. So looking at actual data on that Tuesday, I think the City Council will then have a dialogue and a discussion about whether or not the shelter-in-place order needs to be extended. Today, the city will be putting up a graph on AmarilloAlerts.com so that citizens can see what our graph looks like. We're all watching for the peak and then a sustained reduction in positive cases, but we don't have it yet. As you'll see by looking at our graph, we're still climbing. So I would expect that we would need some sort of extension on that shelter-in-place order, subject to the City Council discussing and deciding what that would look like. Business owners, our hearts are with you as we are, looking at extending this time where we have to shelter in place, and I know it's hitting you hard. But our response in a crisis proves our character, and I'm watching you as business owners continue to take care of your employees, continue to make changes to try and serve your customers, and most of all, just to hang on to the knowledge that this is temporary and that there will be a time where we're done with this and we'll be back to needing your business, needing your services, and needing the products that you sell. So I really believe Amarillo, especially in our business community, that we're more resilient than we believe we are. And I'm sad that we're having this situation that's proving that, but I believe in you. I believe in your resiliency. I believe in your ability to last this out. And I believe in our community's ability to come around you once we can lift this order. I think we're all in right now, sheltering in place, but we'll be all in shopping locally and supporting your businesses if you can just hang on a little longer. That's all I have today. Thank you.
Thank you, Mayor. Now I want to go to Casey Stoughton, Public Health Director, City of Amarillo.
As of 10 o'clock this morning, there were a total of 126 cases of COVID-19 reported in Potter and Randall counties. Since this is a fluid situation, the numbers reflected on our 2:30 report card may increase, but we do want to report the most up-to-date information. This week, Amarillo was notified of an additional death in Potter County, and our hearts and prayers go out to this family. This brings our total number of deaths to 4 in Potter and Randall counties, as well as our total number of recoveries in Potter and Randall counties to 4. The Public Health Department is in the process of compiling demographic information such as race for statistical purposes. When this information is ready, we will release that. Currently, the only way to slow the spread of COVID-19 is to stay home. So we appreciate you staying all in for Amarillo. If you do have to get out of your home, we encourage you to wear a mask, stay 6 feet away from others, wash your hands as often as possible, and use hand sanitizer if you don't have access to soap and water. Our drive-through testing is currently open until 3 o'clock today, and then we'll open again on Monday at 9 a.m. You can call 378-6300, and our call takers will screen you and direct you to our testing center. We are experiencing a phone outage at Public Health. City staff are working very quickly to fix our phones. You can call 378-6300 for directions on how to reach our staff, or we have alternative phone numbers set up at 336-6195 or 671-6068. And those phone numbers are available until our phones are fixed. Thank you.
Thank you, Casey. We now go with Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center.
Yes, good morning. As we end this week, I want to remind everyone that social distancing needs to be our first priority. Please stay home, wash your hands, and wear a mask if you have to get out. Remember to stay 6 feet away from the next person. I think there is evidence that our efforts are beginning to pay off nationally and locally. We still have new cases, and expect we will continue to find new cases as we continue to test. But it's fair to say that the rate of increase seems to have slowed. As time goes on, we will have more and more individuals who will recover from COVID. There is evidence that antibodies produced by individuals fully recovered from COVID can be administered to individuals that are currently ill and improve their status. I've been discussing with Coffee Memorial Blood Center the possibility of developing a program where we can offer this treatment to our community, and they are eager to get this underway in the very near future. We will provide more details concerning this in the near future. So stay all in, Amarillo. Lives are being saved. Thank you.
Thank you, Dr. Milton. Now I go to City Manager Jared Miller.
Right. Wanted to touch base briefly on public safety. Our calls for service still remain low or down versus this time last year. For fire and EMS calls, those are down somewhere between 20 and 30%, depending on the day. Police department calls remain down anywhere from 5% to 10% versus last year at this time. So this is an indication that people are staying home. They are social distancing. So thank you for that. With regard to essential versus low risk, I wanted to give a little bit of clarification because we continue to get questions about that, and it is a somewhat confusing topic. So essential services as defined by the governor's executive order GA-14 will provide services, but should follow the guidelines from the president and the CDC by practicing good hygiene, environmental cleanliness, sanitation, implementing social distancing, and working from home if possible. The governor's order extends until the end of April, so those guidelines are going to remain in place regardless of what the city does on Tuesday, as council will consider extending or not the city's order. Executive Order GA-14 does not, however, direct the closure of non-essential businesses, with the exception of gyms, massage establishments, tattoo studios, piercing studios, and cosmetology salons, which are directed to close by the governor's order. But those are the only ones that are specifically directed to close by the governor's order. The city, through the city order, has provided additional guidance for non-essential businesses in the form of the low-risk criteria, which can be found at AmarilloAlerts.com, AMARILLOALERTS.com. These criteria include: keep all employees and customers at least 6 feet apart at all times, never exceed gatherings of more than 10 people, take extra measures to sanitize common surfaces, and ensure employees and customers maintain enhanced hygiene practices. That it's going to be up to each business owner to determine their circumstances, to evaluate their circumstances, and decide whether to close or remain open under the low risk criteria. The city does not designate or authorize a business to operate as low risk. We don't designate them low risk, but we do provide the criteria by which an owner can evaluate their operations to decide if they can safely adhere to all of those criteria and provide a reasonable and safe place for their customers to shop and take care of their customers' health, welfare, and safety. We've also gotten some questions about golf courses. The governor shared some comments on Tuesday about golf courses, but he left it up to local officials to determine what's best for each community. The city's golf courses have been closed since the end of March. So our golf courses are closed, but while the governor said that he would prefer that golf courses be closed, he did not direct them to close. Finally, I wanted to touch on AmarilloAlerts.com. As a reminder, we announced last week a new emergency notification system to provide current and factual information on a variety of events, including COVID-19, weather alerts, things like that. Excuse me. We encourage citizens to continue to sign up for this service at AmarilloAlerts.com so you can stay informed. As of this morning, we have over 3,500 people signed up for these alerts. So that's really good participation. We are still looking for more people to sign up. That's all I have.
Thank you, Jared. We now want to go through a series of questions that we have received here in the communications department from various sources, social media, phone calls, emails, things like that. Some of them may be directed at one panelist, multiple panelists, so feel free to participate if the question pertains to you in particular. This question would probably be either for Dr. Milton and or Casey. Is there a timeline in the state we might know that the state is starting to recover or has hit its peak as far as positive tests for COVID-19?
I think there are a number of projections about when Texas and the nation will peak. I think it's important to know that we're not there yet. The projections seem to vary. The more recent projections seem to be more optimistic. And those projections are that we may be peaking in the next 2 to 4 weeks.
Thank you, Dr. Milton. This question will probably be for Mayor Nelson and or City Manager Jared Miller. And this has been mentioned before. Both of you mentioned it in your opening statements and in previous news conferences. But explain the relationship between the shelter-in-place directive here in Amarillo and the similar state directive.
Jared, you want to go ahead? I mean, I'll comment on the fact that it's very important for us to be working where we can be working. And so as we crafted our All-in Amarillo order, we tried to consider just how broad we could make the funnel and yet still follow our medical team's recommendations on keeping everyone safe. So we're balancing those two issues, the safety of the public by fighting the outbreak versus who in our city can be working and continuing to balance our economic needs as much as possible. So it is confusing because it's covered by the city's order and then on top of that, the governor's order, and those we obviously fit within the governor's criteria. We would not try to override that, but some of his criteria are more specific than ours. And so, Jared, you want to go back through that? You commented on it earlier, but.
Yes, ma'am. The governor's order is the reason why the governor did not offer prescriptive guidance for non-essential businesses statewide is because they recognize that each city is going to experience coronavirus in a different way and to a different magnitude based on density, based on the amount of travel that their citizens do. So there's a variety of factors that contribute to what restrictions are in place in any given community. So the governor provided enough flexibility to, one, ensure that essential businesses will stay open. It was very clear that essential businesses will stay open and provides guidance on what an essential business is and what categories include essential businesses. It also was very clear that certain businesses that are impossible to operate without very close contact between the service provider and the customer shall close, like tattoo parlors and things like that. I talked about those businesses just a moment ago. It does not offer prescriptive guidance or definitive guidance with regard to non-essential businesses in order to provide the flexibility for communities to do their own solutions like what we've provided with the low risk criteria. It does stipulate that people should minimize their social gatherings and minimize their interactions with people not from the same household, which is consistent with the guidelines that we provided as well. So we have made sure that the city order is consistent in every way with the governor's order. And if ever there was any inconsistency, acknowledging that the governor's order supersedes. However, there are no inconsistencies between the city's order and the governor's order. It just goes a little bit, our order just goes a little bit farther and expands upon those areas that are not spoken to in the governor's order.
Thank you, Jared. This next question, again, both the mayor and Jared mentioned this in opening statements, maybe worth explaining it again. What is the update on the update on the shelter-in-place directive, which is scheduled to expire on the 14th?
We have to consider whether or not we need to extend it. And it's looking like an extension is going to be necessary. We want to use actual data, real-time data in making that decision. I won't repeat the criteria that we'll be looking at, but it will be on the city council agenda on Tuesday for the council to consider an extension to that order. And I would anticipate that if it was extended, it would come in another 2-week segment, and that the order would look very similar, if not exactly the same, to what's out there right now as far as essential businesses, essential activities, and low risk businesses. Jared, do you have anything to add to that?
The only thing I would add is that we're going to very closely pay attention to the guidance and recommendations and direction of Dr. Milton, the Public Health Authority, as well as our Public Health Department and the other departments that are interacting with our community and managing supplies through the incident management team. So we will be very well informed from all those entities as we prepare a recommended extension for council to consider.
Mm-hmm.
Thank you, Mayor. Thank you, Jared. This next question will probably be directed towards either Casey or Dr. Milton. Where is the city right now as far as testing? Are testing supplies adequate? If someone is requesting a test, where would they go to get that? Casey?
So there's multiple pathways to be tested. So a person can contact their private physician. Our hospitals have testing, and every day those testing supplies are replenished and becoming more available. We also have testing available through the Public Health Department. Again, they can call 378-6300. It's a little more complicated today with our phones being out, but there are instructions on the voice message on how to reach our staff. But we do have testing available.
Thank you, Casey. When do you think Amarillo might see more rapid testing results as far as getting the results back?
I do know that there are multiple facilities who are working on obtaining those resources. So hopefully in the next 2 to 4 weeks.
Thank you, Casey. I want to direct this next question to City Manager Jared Miller. Again, you did mention this earlier in your statements, but if you could just maybe go through it again. The current COVID-19 situation, how has it impacted calls to the Amarillo Police Department, Amarillo Fire Department, and entities like that?
What we've seen is a reduction in calls overall. I don't have the exact statistics on which categories are down, but we know that there are significant reductions in calls, especially for fire services and for EMS services. Police services are not down quite as much. A lot of that is due to reports of concerns about whether or not a business is complying with the low-risk business criteria and things like that. So police calls are down somewhere between 5 and 10% from day to day.
Thank you, Jared. I now want to go ahead and distribute some questions we received from Channel 7. These questions would probably be for Casey and or Dr. Milton. In many areas like Louisiana and Michigan, we have seen higher positive tests among African Americans due to many underlying health conditions such as diabetes, hypertension. Do we know how many African Americans are testing positive for COVID-19 in Randall and Potter County?
Our team is still working to compile that information, and we'll be happy to release that as soon as we have that ready to go.
Okay. This next question is similar to this previous question. What is the number of African Americans with COVID-19 compared to other ethnicities? Is it higher or lower?
Sure. And so we're absolutely working to compile that information, and we'll be ready to release that soon.
Thank you, Casey. Here nationally, people seem to be in the habit of stripping off rubber gloves and simply discarding them. Health and law enforcement folks have been seen simply leaving protective items on the ground after leaving a scene. Obviously, that could carry some dangers for others. Is that something that is a problem here?
It's not been reported to us that it's been an issue, but we certainly recommend that if someone has, is wearing gloves or a mask, that they throw those away in an appropriate place. We know that some of our stores have placed receptacles outside for people to throw away their used items. So we encourage, I think there's a phrase, don't mess with Texas, right? So we encourage everybody to throw away their trash.
Thank you.
All right, and we'll continue with the coronavirus coverage on air and online. And to keep up with the latest, you can head over to myhighplains.com. We'll send it back to regularly scheduled programming.
Because you're very likely you're protecting your fellow citizens when you wear a mask. So please do so.
Thank you, Dr. Milton. At this time, we're going to open it up to our local media to ask questions directly of our panelists. If you would, I will identify each media member, and you can do the same. And if your question is directed at one individual panelist, feel free to do so. If it's a general question, you may ask that one as well. I want to go ahead and start off with David Gay of the Amarillo Globe News. Go ahead, David.
There we go. My question is for Dr. Milton. I know that the recommendation regarding the extension of the shelter in place is coming up on Tuesday. I mean, can you tell me a little bit about your thoughts going into next Tuesday? Do you, as of now, do you think an extension of that shelter in place, that all in Amarillo, will be necessary, coming here in the future?
Yes, I think based on the data that we've seen thus far, that's a good idea. I think that if we were to extend that another couple of weeks, I hope that we could save even more lives. So I think so, based on what we're seeing thus far.
Absolutely, absolutely. And I guess the last question that I have is for Casey. That demographic information, will that be a part of the daily report card sent out by the Public Health Department each day?
Yes, sir.
Okay, that's all I got. Thanks, Dave.
Thank you, David. And I want to go to, I think I have this correct, Jack Kessler, Channel 4. Am I correct on my identification there?
Yes, sir.
Go right ahead.
This first question would be for Dr. Milton. We've heard that the hospitals are rationing PPE. How many N95 masks are staff being issued a week who work with positive cases?
I missed the last part of the question. How many PPEs? What now?
We hear that the hospitals are rationing PPE. How many N95 masks are staff being issued a week who work with the positive cases?
Well, those are mainly hospital-related decisions. I'm not involved in decisions of how they're allocating the masks. I will say, generally speaking, that and I speak to the hospitals on a regular basis, that they're in pretty good shape right now, and so there's not a big worry that we're going to run out of N95 masks.
Okay, and this next one is for Casey. We've been told that a worker at a local nursing home has tested positive. How is this situation any different than the child who tested positive at the daycare?
So we're able to, anytime someone is positive, we do a contact investigation. And if we're unable to fill gaps, then we need to alert the community. And if we are able to fill those gaps and make sure that we're able to identify all contacts, then we are able to work through that contact investigation appropriately.
And same question for Casey. Northwest said on Wednesday that they had a staff test positive. How many have tested positive, and has BSA had any test positive?
I'd have to look at the numbers. It's difficult to speak to very specific individuals. It's just related to confidentiality and such. I'd have to look at the specific numbers and get back to you on that question.
Okay. And this one's for City Manager Jared Miller. How many businesses have contacted the city about reopening as a low-risk business?
We've had a number of businesses call, and just to clarify what the criteria are, I don't know how many are operating under the low-risk criteria, although environmental health, building safety, and fire marshals are all working with them in person as they go through their day and as they respond to reports of either inconsistencies with the criteria or just stopping in to check in and make sure everyone's doing what they need to be doing.
And kind of along the same lines there, are you guys seeing a situation where local essential businesses like grocery stores and hardware stores will have to start reducing the number of shoppers coming in more than they already are?
We've had calls with both our grocery stores and our home improvement stores, but some of the largest stores we have in town, just to ask them what their plans are there, so that we can go over challenges that we're seeing and challenges that are being reported to us, and then evaluate and have them report to us what steps they're taking. So what we know right now is that every single one of those stores during this week, in many cases, and in a few cases last week, have started restricting the number of people, number of shoppers in their stores in order to provide the best opportunity for their customers to maintain social distancing. They've also started implementing stickers on the floor showing how far you are away from the next person as you're waiting and queued to be able to check out. They also have a lot of signage in place throughout the stores recommending social distancing, and that most of these stores have sanitation crews that are walking around cleaning frequent touch surfaces like handles on refrigerators and things like that. So we're very pleased with the work that our large stores have done to manage the number of people inside those stores. When you look at the certificates of occupancy for some of them, they can accommodate a lot of people, a lot more than what you would think. And so they've done a great job of reducing that significantly to around somewhere between 4 and 20% of their certificate of occupancy. So they've gone significantly lower than what they could be doing. And that's in the interest of safety for our community.
And
Mary
I'll
Jo,
add,
did you
Jeff, yeah, I'll just add what a great job city staff has done initiating conversations with these big stores and big grocery stores. And I've been on these calls as well, and just tremendous amount of appreciation for what they've done to shift how they're operating in the last 2 to 3 weeks. Everything from how they changed their credit card machines so that fewer people are needing to touch them, and eliminating the need to sign so that we're not all picking up that same pen to sign on the credit card machine. And they've done a tremendous amount of work to try and shift and keep their employees safe and keep their customers safe. And I do appreciate their cooperation. Those conversations are ongoing, and the door is open for them to let us know what they need from the city, as well as environmental health and other staff teams are checking regularly inside the stores to see how are we managing crowd control. But again, each one of us has a role to play. I appreciate the leadership and the cooperation in these stores, but ultimately it comes back down to us. It comes back down to the citizens that are shopping in these stores. How mindful are we of being 6 feet apart? Are we wearing a mask when we go out in consideration of others? Not just keeping ourselves safe, but keeping those people around us safe. So we all have a role to play when we go into these stores, and I'm asking Amarillo citizens to step up and to play that role well.
If I could jump in also and just add to what the mayor just said, I want to encourage everyone to be very aware of where you are inside these stores. And when you, if you realize that you're going to need to get inside someone's 6-foot bubble to get to a product, wait. Because nowadays people get uncomfortable when you step inside that bubble. So we need to be polite. We need to be patient with each other. I want to encourage us to be civil with each other. If someone's taking a little bit too long to look at which package of meat they want, give them a little bit more time. And as the mayor said, do wear those masks. As Dr. Milton has recommended, we do need to be polite. And that's not just a matter of making sure that you don't catch coronavirus. It's making sure that you can provide that peace of mind to your fellow shoppers, that you're not going to give them something you might have.
All right, a few more questions for Ms. Stoughton. Are we assisting surrounding communities or counties when they may not have tests and may not have the ability to test patients while properly protected?
Yes, so we're helping give guidance. We're directing them to the Department of State Health Services. We're answering any questions that we can, and then we're certainly directing them to resources. And so we certainly want to be good neighbors to our neighboring communities, and we have helped. Yes.
I'd like to make a little comment about that too. I'm also on staff at Texas Tech, and the School of Pharmacy has just done a wonderful job. We've got a lot of sophisticated, highly trained people that have been able to actually manufacture some of the ingredients that are necessary to test. And we've been distributing that to various communities in West Texas. And so that's a real great asset that we have here in Amarillo that's helping all of West Texas.
And our partners at Texas Tech have also done a really great job reaching out to local hospitals and providing education and answering questions. And so I think as a community, we've all pulled together to provide what resources we need.
And are we at risk of running out of tests?
No supplies are unlimited. We're testing people who it is appropriate to test so that we can make those resources last longer. And then we're always looking for additional resources.
And where do those tests go when they're sent off?
They're different. There's a number of different private labs and also the state lab in Lubbock. And so they're different communities and different places where those private labs send their labs. I know that's a funny way to answer that question. But the private labs, that's where we send our labs.
I have no further questions. Thank you, guys.
Thank you, Jack. I want to go ahead and give an opportunity now. I think we have a representative from Channel 7 here. I'm not sure on the name, but if you have any questions, just give us your name and feel free to ask now. Going once, going twice. We will move on. Now, we have another representative from KAMR Channel 4. I want to go ahead and allow that person to ask questions if they want to at this time. I don't want to miss anybody. We will move on from that one as well. We have a representative here from News Channel 10. Just state your name and you have a question for the panel.
Hey Dave, it's Ariana Martinez. Hello. So if a business finds out one of their employees tests positive, what must they do in order to stay open?
So we work with the employee and we provide a contact investigation for that employee and coworkers, and we do a risk analysis for each of the contacts. And so not every business has to close depending on the level of risk in that business, but we want to make sure that we're balancing the risk to the employees and the risk to the public with relation to that contact. And so we do that fairly quickly so that we have answers for individuals.
Perfect. So just to clarify, that business would know you'd work one-on-one with them in order to do the best. Okay.
Yes.
Okay. And another one for you, Casey. I know this is a sad question to ask, and I'm sorry I keep asking it, but what is the age of the latest death?
65.
Oh, thank you. And then do we happen to have a percentage of how many businesses, both essential and low risk, have been able to stay open to some capacity here in Amarillo?
I don't know. I would say that it's a majority, a vast majority, certainly of the essential businesses, because they're more directed to stay open. However, the non-essential businesses, I don't have that number.
Are there any differences in how this virus affects pediatric patients?
Generally speaking, it seems to spare severe disease in pediatrics. That's not to say that there aren't outliers, and that's not to say that children don't get infected. I think anyone would be at risk of getting infected. But as a general rule, children seem to have milder disease.
Thank you. And then how, do we know if we will continue drive-through testing next week as well?
Yes, we will be open again on Monday, and we plan to go through Friday.
Perfect. And last question, is it true that a resident at a nursing home in Amarillo did test positive?
We're working with every positive that we have and working on contact investigations. And so we have, we will, anybody that tests positive, we do those contact investigations for.
Okay, that's all I have. Thank you, guys.
Thank you, Ariana. I want to go ahead and throw one in real quick since I have the opportunity for Dr. Milton.
Okay.
When do we expect to be able to test for antibodies to see if people have already had the virus? You think that will that be coming anytime soon, do you think?
I think that it is likely that relatively soon that's going to be offered. And there's been some efforts already at that, getting that started, I think, at the medical school. I could say that. And then, just from listening to national news reports, even Dr. Fauci, I think this morning was commenting that the testing abilities are going to increase rapidly over the next week or two, hopefully. There's some advantages to being able to verify whether someone has protective antibodies. Obviously, it would give a lot of assurances to individuals to get back out in the community and start working. So I think that ought to be a priority as this testing becomes more widely available.
Thank you, Dr. Milton. That was all of the questions we had today for our panel. We're going to wrap up the news conference now. We want to thank all of our panelists for taking time out to be here. Again, we do this 3 times a week, every Monday, Wednesday, and Friday at 11 a.m. We want to thank our panelists for taking the time to participate. Thank everyone for viewing, and we will see you again next week. Thank you.